Hey there, and welcome back to the 120 Pod with Jackie. If you saw my first episode and you came back here for the second part of my septic shock survival story, I thank you for coming back, tuning in, and listening as we talk about all things sepsis, chronic illness, and disability related. As I mentioned, my name is Jackie. I live in Central Maryland. I am a septic shock survivor. I have chronic conditions that cause hidden disabilities, specifically Crohn's disease, hypermobile Ehlers-Danlos syndrome, POTS, and osteoporosis. And 4 years ago, I nearly died of septic shock. I want to take a minute here in the beginning to thank all of you who have been passing around that GoFundMe link that my family set up recently, 4 years later, better late than never, I guess, to help overcome some sepsis crisis related debt that we accrued 4 years ago when I went into septic shock. My husband and I are both disabled. We were only living on disability income. Our kids, two of them had just graduated college, didn't have jobs yet. My other daughter still had 2 years of school left, of college left, and living on what we were living on at the time. I look back and I don't even know how we made it. One of the ways we did make it was we piled all of our debt onto these low limit, high risk, high interest credit cards, which we are still trying to pay off. Now, thanks to so many of you, I just paid off one of those credit cards. So that GoFundMe is working. I am so appreciative. Just to be able to pay off one of those cards has made me sleep a little bit easier at night. But also, I realized when I raised the issue of the GoFundMe and I posted it on my social medias, I began to realize that people were messaging me, also sepsis survivors who could relate. They also suffered financial crisis in addition to the medical crisis. I mean, it's one thing to survive sepsis, then it's another to go, how am I going to pay for things? Some people could not go back to work right away. Look, sepsis is not something where you just jump up out of the ICU bed and you keep going. It's not like you just had a cold or the flu and you recover and you go back to the way things were. That's not how it works with sepsis. Sepsis survivors carry a lifelong burden. We're never the same. And it takes a long time, which is what I'm going to discuss in today's podcast, that it takes a long time to recover, to learn to walk again, to learn to feed yourself again. Some sepsis survivors have lost limbs. They need prosthetics that they can't even afford, or service animals. And we'll see many of them are trying to fundraise to help get these needed, very necessary, and critical medical needs addressed. So it came to my attention. I'm seeing your stories. I'm hearing from you and hearing even how one had lost her home because she suffered sepsis and couldn't go back to work right away. And I'm thinking this should not occur. So, in addition to some of the other things I'm involved in, I write part time. I used to be a journalist. I have been a journalist actually since 2001. I took 10 years off because of my chronic illnesses and disabilities. I couldn't even write, I couldn't do anything. After I survived sepsis, I got some much needed care, just the right amount of care that has helped me be able to write again part time. And of course, I engage in a lot of advocacy, public speaking, teaching about sepsis. I go out into my community and I host these sepsis talks, I call them. And so I will go to the 55 and older senior living communities to talk. I have spoken at our local YMCA to our YMCA members, and I tell my story and I help educate people to prevent sepsis. But what happens if you've suffered sepsis and you're suffering a financial crisis because of that? So, my dream nonprofit to start, and guys, hear me out on this. This is something I would really like to start within the next couple of years. And I'm starting to talk to some people who have started similar types or other nonprofit foundations to help a specific group of people. And I want to help sepsis survivors. I don't want you to go through what my family went through financially. So I want to create a nonprofit that would provide financial assistance. in block grants, $5,000, $1,000. I mean, whatever it would take to help a family when a family member has undergone a septic shock sepsis crisis. Okay. So that's going to be one of my dream projects that I'm working on. If any of you listening know about starting a nonprofit, as I said, I am speaking to some people who've started some wonderful nonprofits, and I'm trying to learn and I'm trying to get ideas. But I really, in my heart of hearts, I want to help save other sepsis survivors from the financial problems that we sustained after I survived sepsis. So, anyway, with all of that said, again, thank you all for been contributing to our GoFundMe. The link is here. It's below in my description. It's one of the first links. I think there with also some links to my stories and my articles that I've done. I've written about sepsis twice, actually, my own septic shock survival story for the Washington Post. I wrote about it for the Healthy at Reader's Digest. And so those links are also below. And I've done other writing, sepsis related writing and other health, and on other health issues as well. Okay, so my recovery, how that went, how it's going today. Well, how it went was, first of all, I don't even know how I survived. I did not expect to wake up again. I didn't expect to open my eyes again. When we last left off in my last podcast, I had been flown by helicopter from the hospital where we were living at the time at Meredith in Hagerstown, and I was flown from the emergency room there directly to shock trauma in Baltimore. I closed my eyes. I thought that was it, and that was the end of me. I did wake up hearing the surgeon talking to me. My surgeon was saying that I was very sick and they were surprised I survived, but they were glad. And, essentially, I was still on this planet. And then my husband was allowed to come in the next day. He visited me. I was in the SICU. That's what they call the ICU at shock trauma. I was in the SICU. I was still on the ventilator. I was very sick still. I had just undergone like a 6-hour surgery where they had to remove a part of my colon and place a temporary colostomy to help my intestines heal. That was going to be in place for about 7 months. So my husband comes in to see me. Of course, he's grateful that I survived, but he got there on fumes in our 16-year-old minivan. And one of the first questions I remember him asking me was, which credit card do I put the gas on? So that's how bad it was back then, folks. And like I said, we're still paying for that today. Anyway, but moving on. There was, of course, the nurses in my SICU were wonderful. I remember as I was awake and I was kind of aware that my husband was there. I was aware of the nurses, but I was still really tired. Like I said, I still had the ventilator in. They gave me a whiteboard to communicate, and I was writing things that made absolutely no sense. It was all in gibberish, and you could see some of those images here. The only sentence that I don't even know how I did it, but there was one sentence I managed to spell correctly and write out so that they did know what I was saying, and it was, now I know why I was in so much pain. I didn't have gut pain. Remember, as I described, I had left hip pain. And the left hip pain got so excruciatingly bad that I couldn't even move my left leg in the morning. That's what prompted my family to call EMS. And good thing they did, because I wanted to go back to sleep because I was so tired. I had not slept at all practically that night. It's kind of an off and on kind of sleeping, when you're in a lot of pain. And I wanted to go to sleep, like sleep. And well, had I done that, it would have been a permanent nap. So thank goodness for my family calling EMS. Thank goodness for me getting the timely and quick care, swift care and attention that I needed that day. So I'm in the SICU, I'm on the ventilator, trying to write things out. It was the next day. I don't really remember too much of that following day after the surgery. Like I said, I was tired and I was in and out. The next day, they did pull the ventilator. My oxygen levels were looking better. And then I just had to wear like an oxygen nasal tube after that. Pulling that ventilator, honest to goodness, felt oddly satisfying because I wanted that thing out of my throat. Yes, you are very aware that you have it in your throat. And that's why they tie your arms down so that you don't yank that ventilator out. I got progressively um, a little bit better the next day to where I was a lot more aware of what was going on. And the nurses did try to have me stand up with the use of a walker, and that wasn't going really well. And I was unable to walk. That's when we discovered, yes, I was totally unable to walk. And then they used a Hoyer lift, which is a lift that comes down from the ceiling and it has like a soft canvas that they wrap around you, and you're wrapped like a little taco. And that's how they would move me around the room, try to move me so I could sit in a chair. Remember, after all the surgery and everything that I went through and lung damage that I sustained from the respiratory failure, we needed to prevent pneumonia. They gave me one of those little plastic things with the ball inside. I hate those things. To try to breathe, and you had to breathe in and pull that ball up. That I couldn't even get that ball to move, and it didn't help. One of the doctors kept saying, "You're going to get pneumonia. You need to really do that every 15 minutes." I was lucky that I was existing at that point, let alone use that plastic thing to, you know, um, pull that ball up. I know she was saying it for my own good, but oh my God, I was so weak. And using the Hoyer lift enabled me to sit up in the chair. So that helped my circulation, would hopefully help prevent blood clots. And I was in the SICU for 8 days. The nurses there were splendid, they were extraordinary. They took exceptionally good care of me. And then it came time where they decided I could be moved to the step down, but I'm still not walking here. My legs felt like my feet and my legs were really heavy, and it was like my feet were magnetized to the floor. I couldn't shuffle them, I couldn't move them, like I couldn't even lift them an inch up off the floor. So it just wasn't happening. So they still used a Hoyer lift downstairs. I was still catheterized. I was still hooked up to a lot of tubes. I still was using oxygen, and I spent another 8 days on the step down unit where it was decided that I would then go to inpatient hospital rehab to help me learn to walk again because I could not go home in the shape I was. I was not happy about it. I missed my home. I missed my husband and my kids. My kids they were able to visit me. They each took a turn. My son came one day to see me when I was in the step down unit. My other daughter came one day, and then my other daughter, I have two daughters that came. So they came to see me. They could come one at a time because this was still the height of COVID 2021 in May and June, and also because of COVID restrictions. When I did get to the inpatient hospital rehab, my husband was the only one who could come see me. Normally, before COVID, families could all come and help their loved one who was in there to recover and learning in the gym. When you go to inpatient hospital rehab, it's typically 6 hours of work a day, and it is work, 3 hours in PT, physical therapy, and then 3 hours in OT, occupational therapy. And that was, oh my God. I mean, they wake you up at 6 o'clock, you take your pills, they bring your breakfast. Plus, I had a new way of trying to figure out how my body was going to work with that colostomy. That ostomies are very life saving. And for many people with Crohn's, they do wind up, Crohn's or ulcerative colitis patients wind up with um, a colostomy or an ostomy sometimes due to the need of having resections done because of the diseased inflammatory bowel disease that's going on. They get bowel resections, and some have permanent ostomies. And as far as I knew at that point, mine would be a temporary ostomy until my insides healed. But I was trying to figure out how that worked. And it was kind of frightening to me because, on that Friday, everything was working the way it always had for 58 years. And then over the course of 24 hours, that changed. And I had to figure it out. And the nurses helped me. They're what they call ostomy and wound care nurses. So I got visits from the wound care nurse, and she was helping me and my husband figure it out. My husband actually had to assist a lot because I also had cataracts at the time, and my vision was very yellowed and blurry, and it was difficult for me to see, let alone prepare the ostomy bags and the things that I was going to need to care for the ostomy and to apply the bag on the adhesive to get it to stick to my skin. It just occurred to me, those of you who are listening, and you may not know what an ostomy or a colostomy is or an ileostomy, but that's essentially what took place during the surgery, that my bowel was so injured from the diverticulitis and the perforation that they had to remove some of it, and the colon specifically, and then they pull a piece of your intestine out into your out of your abdominal wall, only about an inch or so. And so it's literally a piece of your intestine. That's called the stoma. So that is what an ostomy is. And so I had one, and it was on the left side. And you have to um, have, ostomy bags and ostomy supplies. And because the waste has to go somewhere and it goes in a bag. And anyway, we're going to do a few podcasts in the future on ostomies because there are some really awesome ostomates out there. That's what you call other people with ostomies, ostomates, and they have brilliant insight. They provide great support on social media for other people who are new to the ostomy world. And we are also trying to reduce the stigma of having an ostomy. So I just wanted to give a little bit of that PR there to the ostomy community and to educate all of you as to what an ostomy actually is. So anyway, like I said, 8 days in SICU, 8 days in step down. Here I'm in inpatient rehab. I was miserable to my core because I was still very weak. I was still very exhausted. I would go in that gym. I would work out with my physical therapist, my occupational therapist. I had to learn to feed myself again. Look, guys, I was so weak that the little orange juice containers they give you when you're in the hospital? Well, I could not tear the top off. I couldn't even tear the top off of that. I didn't have the strength, finger strength, hand strength, none of it. I didn't have any of it. So I was very, very weak. Needless to say, I needed those 3.5 weeks that I spent in rehab. And it's really cool when you do leave, you get to ring a bell. Just like cancer survivors, when they finish radiation, they get to ring the bell. Well, when you're in physical rehabilitation like I was, you also get to ring the bell the day you're discharged to go home. And I couldn't wait to go home, but I also was terrified because I knew that I was still weak. Again, as I said in the beginning of the podcast, sepsis is not something you just bounce right back from. It takes a real toll on you. And I was still so weak. And even to the point where I was discharged, I got to go home, but I still wasn't strong enough to make my own meals. I couldn't even pour myself a bowl of Cheerios. My husband had to do a lot of that for me. My one daughter, the one who had just graduated, she was home and looking for work and applying to jobs. My other daughter was getting ready to go back to school. She worked a summer job at the state park that summer, and then she was getting ready to go back to school to her junior year in college, like around mid-August. So when I was discharged from inpatient rehab, it was the day before Father's Day. But I did have to go back within a week. I was back in the hospital because I had a post-op abscess. Or they called it a retroperitoneal abscess, fancy word for, like a space here on the side of your abdomen. And they had to insert a tube. That was fun, not. And they inserted a tube. I was back in the hospital in Hagerstown this time. They did consult with my colorectal surgeon at shock trauma. They sent her the CAT scan imaging that showed I had that infection, and she said that it was okay to treat me there locally near my home. So that saved my husband some time, travel, and gas, just, coming to support me every day as he came to see me in the hospital. And my daughters were able to come see me in the hospital too. Now, I do want to say that for sepsis survivors, surviving sepsis and for sepsis survivors themselves, It's really traumatic for the survivor, and it's really traumatic for the family too. My son was very upset that summer. My daughters were upset. Like nobody kind of knew what to do. I was crying every day. I was busy crying and mentally losing my shit. I was batshit crazy. There's no other way to describe it. I would get up in the morning and walk into the kitchen. I'd use my walker and look at my husband and I'd start crying. And that was every morning. Every morning. It's a wonder he didn't get a complex or something from all that because I was not sure why I survived. I thought I was going to be a burden on my family forever, that I was always going to be like that weak, that useless, that just this like hunk of body just laying around all day. I I questioned why I survived, and I will tell you there were some times that I was not um, I was not happy that I survived. And I hate saying that because 350,000 people every year die of sepsis. 350,000 adults and 6,800 kids die of sepsis every year. But I just didn't know what to do with myself. I was so exhausted. I was so weak and I felt so useless. And plus I was just even though my family would disagree, I know they would. I was a tremendous burden. I couldn't wash my hair in the shower. My husband had to assist me showering, but I didn't have enough strength to wash my hair while I was in the shower. So I would, my daughter, one of my daughters found like an inflatable wash basin on Amazon and she ordered that. And I would lie on the bed and put my hair, like sort of when you're at the beauty salon, and I would put my head back in that inflatable wash basin, and she would wash my hair. That was the only way I was getting my hair washed. I was just that weak. I could not stand up long enough. I couldn't sit in a tub comfortably. I was still in a whole lot of pain in so many different places. Being a hypermobile Ehlers-Danlos patient and a POTS patient and dealing with septic shock recovery was really challenging. Thank God the only thing that was really quiet was my Crohn's disease. And Crohn's being an inflammatory bowel disease, I guess I should be really thankful that that didn't start acting up while I was trying to recover and my insides were trying to heal. And as I said, my husband had to assist a lot with showers, with dealing with the colostomy and everything. I mean, he had to assist me with everything. And he is disabled as well. He has severe rheumatoid arthritis. It was stressful on him. It was stressful on my daughters seeing me the way I was, my son. But the one thing was they were just so happy that I survived. I'll never forget this birthday party they planned. They planned a birthday party for me. It was after my youngest had gone back to college. She had to go back mid-August. I was not able to accompany her and help her move back into the dorms. I was so upset and sad about that. And my other daughter stayed home with me while everyone else took her back to college, my husband, my son, and I sat at home and I cried all day, all day on my daughter. And it rained horribly that day too. I remember I thought, yeah, this is a great day. And again, remember, I'm thinking I'm never going to get any better than this. This is it. So my birthday is September 13th. It happens to also fall on World Sepsis Day of all things. And so my kids decided, my daughter, who was still at home, still looking for work, and my son also looking for work because he had just graduated too in May with his master's. And so they planned a surprise birthday party for me and my son and his then girlfriend at the time, now his wife, but they all got together and clued in my daughter who was away at college that we're going to have mom a surprise birthday party out in the park. And it was still the height of COVID. Delta variant was running rampant then. So my son and, my now daughter-in-law, they did not want to get me sick, especially at this stage of the game. So being as they lived somewhere else, in another household, we would meet up outside. We kept our meetings to the outdoors. And so they got this old pavilion and we had this little birthday party, and my daughter-in-law's mom made a cake, beautiful cake, most beautiful cake I'd ever seen. And that's when I started to realize maybe I was so lucky to have made it to 59 because I almost didn't. And I think my kids were really grateful too. And that's why they wanted to have that party. And we're Marylanders. They had blue crabs there and everything. And I know my son had just gotten some good news back then that he was going to get a job, and my daughter too. So there was things to celebrate. There was joy in all the crying and all my tears, and I'm just tearing up just thinking about it. Sorry, guys. Anyway, so I got through September. October comes. I had outpatient physical therapy. I graduated from home care to outpatient physical therapy, and I started to realize, hey, I don't need my wheelchair as much. For some odd reason, removing a part of my colon, also some of the hip pain I used to suffer before that went with it. And my doctors are still stumped to this day. But I began to challenge myself. My husband and I, he would take me to that local park, the same state park my daughter worked at that summer, and we would take walks. And I started to walk like more and more. And he would actually start riding my mobility scooter because we would still bring the scooter to see how far I could go. So it was like Rocky. He was like my coach, come on, you can do it, you can do it, as he's riding the mobility scooter. Um, I discovered I had very low iron, and my hair fell out too. Forgot to mention that in July of that year, my hair had fallen out. And a lot of sepsis survivors I know talk about that. So my hair fell out. They discovered, it was actually in September, my gastroenterologist discovered my iron was really, really low, like a 6. He said, you're going to need iron infusions to go through the next surgery, the colostomy reversal in December. It was scheduled for December 8th. And I was very nervous about that because I have PTSD really bad. I suffer really bad PTSD. And I I was scared of the iron infusions, and the hematologist was really busy that week and didn't have time to explain it to me. Something we discovered through all this was if I need any new procedures or surgeries or anything, as long as the doctor can discuss it with me and or the treating provider can explain it to me in a little bit of depth, maybe more than they think is necessary, then I'm cool with it. But she didn't have time that week. And I just wound up going to the first appointment for the first infusion. And they have the iron looks like brown mud in a bag. And the nurse was ready to deliver it. She was ready to put the IV in my arm. And I chickened out, started crying, hopped on my scooter. I'm still using the scooter for support at that point, and left the treatment area saying, I'm sorry, but I can't do this. And then a friend of mine got wind that I had left the first iron infusion appointment, and it just so happened her husband had had these same iron infusions, and she had him call me. And I'll always be thankful to that man and his wife. We knew them from basketball. My youngest daughter played soccer and basketball, and in high school we had our own little bleachers section for the handicapped and the disabled, and we were there. And that guy called me and he talked to me so wonderfully and heard me out and listened. And then he said, you got to still get the infusions. He says, I got them and I'm fine. And you're going to be fine too. So guess what? I did go back. I did get the infusions. I needed 6 total. My iron was that bad. I was also terrified of blockages because of having the stoma and the colostomy. And before I left the hospital, the inpatient rehab, the nutritionist said, she gave me a list of foods that could cause a possible blockage. It was practically everything I liked: pickles, mushrooms, um, spinach. So I avoided all of that. And for 7 months, I ate cream soups, Cheerios, scrambled eggs, and yogurt. I dropped so much weight. I was 117 pounds when I went back for that colostomy reversal in December. And I needed a colonoscopy like a month before that. They had to get in and make sure that everything looked fine and was healed and was ready to have the reversal in the first place. So that, of course, gave me a lot of the willies. I was really, really scared. But I was being treated by my longtime gastroenterologist. I went back to him after being ignored by the first gastroenterologist's office, who did not pull me in time before my colon perforated. If you recall, um, we did know I had a thickened bowel in April and I was supposed to see a gastroenterologist. I was trying to see someone local to my home, but the receptionist kept insisting they didn't have appointments till mid-June, and my colon didn't wait. May 22nd, it perforated. So anyway, so I went back to my guy, my great, great, wonderful gastroenterologist. So the colonoscopy itself wasn't that bad. I knew I was in good hands with him. And the colorectal surgeon who saved my life was going to do my reversal. So I knew I was in good hands with her. But the trick was getting me to go back in there. So I did raise a bit of a ruckus in registration. I did start crying. I did try to leave through the doors, those doors that open, those automatic doors when you step on a certain area and they open. I kept walking in circles in front of those doors and they kept opening, and it's winter and it's cold and it's December 8th. And my husband was following me, but he wouldn't follow too close because he knew better. And he was like, "What's the matter? Are you going to do this?" "Yes, I want to do this, but I'm terrified." And it took a lady in registration, a lady named Tasha, who was wonderful, who came over. And once they could get me to sit down, she sat down beside me and she talked to me. And she just talked to me about things that gave me joy, my kids, and when I used to be a writer, and what had happened to me in May. And she was like, "You survived septic shock. You're going to be fine. This surgery is going to be fine." And I was talking about Dr. Bafford and how much I liked her. And she said, "You're going to be okay." And she followed us. She accompanied us up to the pre-op area. And once, of course, that anesthesiologist came in and gave me the wonderful little tripping drug, then I was a lot better. And then I was no longer a flight risk. So the surgery came off without a hitch. That colorectal surgeon and her team did beautiful work once again. It did take about 4 days for things to start working again. And I was scared, but as with University of Maryland doctors, they are exceptionally good at teaching their patients. It's a teaching hospital. And it's apparent that with these doctors, they can teach us, they talk to us in a way, at least me, they talk to me in a way that I can take in the information, understand the information, and feel at ease. So when day 4 rolled around and I was really bloated and pain, I had a lot of stomach pain, and I called the nurse and said, "Get the colorectal team in here. Someone, I don't think the reversal worked. I think something's wrong." And he came in, one of the other members of the team. He came in because the lead surgeon, she was off that weekend. But he comes in and he started teaching me all about the intestines. Yeah, I know y'all want to hear this, right? So if you have IBD and Crohn's and ulcerative colitis and all that, this is no new news to you, okay? But the rest of you, I apologize. But he started talking to me about the intestines, and he said the intestines like to be in a dark space. It's closed in there. Nobody ever opens your abdomen and can see in there. So they're in a dark environment and they love it that way. We go in during these surgeries with bright lights. We go in and, start messing around in there. and the lights, and they don't like it. The lights come in and they freeze. They freeze, and his eyes were really big, and he was standing there like this. He said it takes a while for them to get over that. And luckily, with the reversal surgery, they were able to go in laparoscopically, meaning they only made small little incisions, not like in May. I had a 12-inch incision. I still have the scar down the middle of my abdomen. And I also had the stoma scar too here. But you know what? That's okay because those scars tell my story. Those scars are who I am and the life I've lived. So I'm good with the scars. Shortly after he was in the room doing his very humorous interpretation of intestines, things started working again. And I felt so much better. Now, the recovery, like I said, still took a very long time. I was still very weak, and I had to start back over in PT from square one because even though they didn't have to make a 12-inch incision the second time around and they just made small incisions, I was still really weak. And I finally got my cataracts taken care of that January and February. They did this eye first because this one was the worst, and then they did this one. So I am finally able to see clearer. That was like night and day when they do your cataracts. So, all right. Anyway, I'm going to wrap this up here soon. I just want to say that it was a very long recovery. I do talk about it on my Instagram at Jackie's Journey 4. So I've discussed my recovery at length ad nauseum on there. It took a good year before I was able to start like part-time writing again. It was 2023, actually, more like a year and a half. I spent a lot of time in physical therapy. Then we signed up at the YMCA so that I could go there and swim laps. I will tell you this, in physical therapy, the second time around, my doctor really wanted me to do aquatic therapy to strengthen my legs. And I do think it was a combination of the colon removal. I would never recommend that as a treatment for weak hips, though. And also the aquatic therapy that helped my hips enough that it helped me be able to finally strengthen those muscles more around there so that I could walk longer. And I was still a bit of a head case even after the reversal. I think with the reversal and surviving that one made me feel a little bit more confident that I wasn't going to die quite so quickly as I thought because I was a septic shock survivor and things I'd read online. I had actually stopped Googling sepsis because there's a lot of talk on there and studies showing that, we have a higher mortality rates or we develop other problems. And yes, I do have lung damage from sepsis. I mean, yeah, sepsis is like the gift, quote, quote, that keeps on giving. But I was still a bit of a head case and I was still scared and I was still crying and very emotional. And then on Instagram, I discovered the Sepsis Alliance. And when I found Sepsis Alliance, I reached out like on Instagram and I went to their website, www.sepsis.org. And I discovered that they had online peer support groups, like chat sessions for survivors, caretakers, and for people who had lost a loved one to sepsis. And I thought, what a wonderful organization to do this, to afford us the ability to meet and greet and talk with other survivors. And so I signed up. I saw it was actually a pilot session. They were going to have a pilot online Zoom for sepsis survivors. And I signed up because they were trying it out to see if it would be great. And 2 years in, these groups are very, very popular. So if you are a sepsis survivor, or if you tragically lost somebody to this dreadful condition, or you're taking care of someone who is a sepsis survivor, go to www.sepsis.org and check out these peer support groups. They also offer a lot of things like free ongoing education for medical providers They have seminars all the time. They're always advocating for survivors and for the prevention of sepsis. It was started by Dr. Carl Flatley when he lost his 22-year-old daughter, Erin, to sepsis from a post-op infection. And Dr. Flatley wanted to do something about it because he didn't know what sepsis was at the time. And he founded Sepsis Alliance. And it has grown by leaps and bounds. As I said, these online peer support groups are the best. And the first meeting I went to, I got to see there were about 8 or 9 other survivors in there in the Zoom. I could see them, I could hear their stories. I felt better because I knew they understood me and I understood them. And I figured if there were people in there who had survived sepsis 5 years ago, 10 years ago, and they were still alive, that I had a good chance of survival too. And that helped turn my mental break around. I also did go to in person counseling once a week, but that peer support group meant everything to me. And I still am in the support groups. I'm actually helping moderate one now for sepsis survivors with hidden disabilities. And I love the people you get attached to these people, you get to know these people, you care about them, they care about you. And like I said, the biggest thing is Sepsis Alliance provides us this forum to have met each other, interact with each other, and to help support one another. And that is really, really important if you're a sepsis survivor, or if you lost someone to sepsis, or if you're taking care of someone who survived sepsis. You need support. It's a lot of head games that go through our heads after this. And being as we're still trying to raise the level of awareness so that more and more people in the US know about sepsis just as much as they know about cancer and stroke and heart disease, it's really important. It's really important. What is it they say? To find your tribe, to find your people. And I've definitely found my people, and I have Sepsis Alliance to thank for all of that because I am still very much in recovery from sepsis. And it's, like I said, part of the reason I wanted to start this podcast is it's helping me, and I hope it's helping all of you. So, that's it, guys. You have endured the first 2 episodes of my podcast with just me. The next episode, I will be interviewing someone who knows a lot about sepsis, Dr. Karen Molander. She's also on board with the Sepsis Alliance. And like I said, she knows a great deal about sepsis. And we are going to get into this question of what is sepsis? And that's what we'll be talking about in episode 3. I can't wait to have Dr. Molander on, and I'm really, really looking forward to that episode. I hope that it will help a lot of you as well. For now, take care. I'll see you soon. Love y'all. Bye.